Hi there, and welcome to Canceling COVID. I'm Tonya Rivens. Of course, we are live coming to you on this Wednesday. Boy, did the weather switch up on us or what? Come on now, it is the fall season, but it's a little bit breezy out there today. So make sure you bundle up and layer up as you head outside. But most importantly, thank you for bringing us along. Of course, we're mobile, we're on Facebook Live, we're also on YouTube, and we are here to bring you real resources, real talk as we continue to deal with this thing called COVID. Of course, welcome to Counseling COVID. I'm Tonya Rivens, and your safety is a top priority as we bring you real resources and real talk as we navigate during this pandemic. Now, I want to say thank you to our sponsors, Mecklenburg County Public Health, mecnc.gov. That's mecnc.gov. You see their information strolling, that is, across the bottom. Had to get that STR out. Strolling across the bottom, or scrolling across the bottom, rather, 980-314-9400, 980-314-9400. And thank you to our other sponsor, which is Groundwater Solutions. Dr. Tracia Black will join us shortly as we continue to share more information. We also want to talk about the big headline today, and it's a pretty big headline. Children as young as 5 are next in line for the Pfizer vaccine. The CDC has now given emergency approval. So here we are. I saw one headline where some medical professionals said, you know what? We've been waiting for this. So they see this as also another way for us to get out of this pandemic. Regardless of how you feel, there are some people that do trust science and they are willing to go ahead and, as people are starting to say, have their kids take the jab so that we can try to navigate and return somewhat to our new normal. Now, parents in a YouGov poll, they seem kind of split over the decision to vaccinate their children, and I can understand that. 37% said they would, 26% said maybe, and another 35% said no. So those numbers are all kind of even. 37% says, okay, we're going to do this. 26% said maybe, and another 35% said, no, I'm not happening. That's not happening. So I'm just curious. I see you hopping on. Are you surprised to hear this? Please share your comments in your chat. Are you surprised by those numbers? Let me know. Your thoughts, especially as parents. Are you planning on getting your child vaccinated? Or you one of those people that are like maybe, or you just flat out no, it's not going to happen? We'd love to hear and share your comments. In addition to that, we've got gift cards to give away for those participating. You can go to Canceling COVID on my website at tonyarivens.com and submission, and I'll be more than happy to provide those gift cards as we look to give away gift cards to those people that are interested in sharing their information and providing feedback. Now, we'll be checking on the pediatric rollout with Dr. Black in just a moment, but first I want to talk to someone as we are heading into the holiday season. And we're going to have, of course, the winter months, and we'll have more people gathering, a lot closer headquarters, a lot of close quarters, that is, not headquarters. And of course, because we're heading into the winter months, and you've heard us talk about this, the professionals have shared, and they've talked about it as well, how there's reason for concern, and lightly so. But now also it's the time to come up with a safety plan to lower the risk of exposure at your holiday events, whether it's a dinner party or even just a gathering. You know, a lot of us get together, especially for Thanksgiving, huge for family gatherings, getting together and just a great time for fellowship, food, family, all of that happens. And just trying to find out where you are, what kind of precautions are you taking. So I want to bring in one of our guests who is doing something really unique. Her name is Nicole Campbell, and she's doing something that we all should consider. We all should make plans, and we should all be aware. First of all, Miss Nicole, thank you so much for taking the time to talk with us.
Oh, you're welcome. No problem.
All right. I see you enjoying some of that sun. Girl, it's chilly out there, but the sun does help. It's just a little bit of breeze. So thank you. It looks like you're in your car, so you're probably fairly busy. So let's talk about right in the middle of December's holiday season. You and your husband, y'all are doing a vow renewal. So kind of walk us through your decision to require everyone in attendance to be tested for COVID. Let's talk about that.
Okay, so I got a grandmother. She will be attending the wedding, and she had asked me what type of safety protocols that I have in place for them. So I didn't really think about that, to put that in place for them. So besides me inviting a limited amount of people under 100, plus the facility in the venue is big, so I'm thinking we could safely social distance.
Mm-hmm.
Um, and with the amount of people that we have. But that she said something, and I thought about what she said. I said, oh well, let me go ahead and take this a step further for her.
Right.
Let me, even though she got a vaccination already, she should be coming to a facility or an event that's going to have extra precautions and measures for her, because she's older. She's in her 70s or 80s. So I decided that to look at the CDC guidelines and find out what everybody else were doing. And once I read that, and I said, well, I'm going to have everybody to take the test to come to my event, to the vibe renewal. So I requested for the guests and the vendors to submit a COVID test up to 72 hours before the actual wedding day, which is on a Saturday. So they
Wow.
are to take a test on up to the earliest day is Wednesday, and then it could be a PCR test or a rapid test. So I asked them to do that.
So those are the requirements, and Nicole, salute to you for taking those precautions. And it really kind of sounds like the new norm. That's what a lot of people are requiring now. So exactly, they've got to take the test and get you the results. Now, what if someone does submit and they are positive, or if they show up at the location and haven't taken it? Will you have someone on site to offer it?
Yeah, no, ma'am. I
Okay.
did look into that, and it costs like thousands of dollars to
Wow.
have that service available for them. I think it was like $72 a person, and that would cost like a lot of money for us. So I didn't want to put that. I didn't want to spend that amount of money for that. If they show up to the venue and they don't have a negative test, then they will be turned away, unfortunately.
Well, I've
Um,
got I've got Dr. Tracia Black who's coming up next, and that's what I was getting ready to share. I thought all testing and on vaccines and boosters are free. So hopefully
right.
Dr. Black Al can connect because they offer the service for free, and I know she'll be more than glad to assist you. I want to also pause and salute you and say thank you for taking it that to that level, because that's what we have to do. I've got an 85-year-old mom. You're thinking about your grandmother. You're thinking about everyone else. You're thinking about the spread. So it's okay for us to get together. It's okay for us to have fun, but we've also got to take these precautions.
Mhm.
When you were making this decision, what kind of made you decide to be so cautious?
Because like you said, it's the flu season. The flu is out there. It's
Hmm.
December. COVID variant is out there as well. So I just wanted to take these steps, because so many things is out there for us to get sick. Even if you're not feeling well and you're
Right.
testing negative, please don't come to the event.
Yeah.
You
Just stay at
we're,
home. Well, okay, you can
yes,
miss the
I'm
party, right?
right. We're
So what
also
kind
going
of
to be wearing.
response? Go ahead. What kind of response are you getting then? Are people kind of like who she thinks she is, or I ain't going? How are they responding to you?
some some people that were vaccinated already was like, well, do I have to take the test? I'm vaccinated. Yes,
Uh-huh.
ma'am. Yes, sir. You
Okay.
have to take the test, because you can still pass COVID and catch COVID
Right.
if you're vaccinated.
Uh-huh.
Some people was like, well, I'm already taking a weekly test. Why do I have to get tested time like 3 days before the wedding if I'm taking it on like a Monday? No,
Right.
you still have to take it on a Wednesday or a Thursday,
Hmm.
to be safe. Some people even rescinded their RSVP, which it hurt my feelings a little bit, but
Uh,
it's, yeah, it's okay.
well, are you, I want to ask this, and this is a little personal. So are you, I guess, on your job having to test daily or do the whole testing thing? Because a lot of people now, testing is the new norm if you're not vaccinated. So, for people to
Mhm.
make that comment or feel that way, in your situation, have you been around people that are having to get testing, on a normal routine?
Yes, I am one of those people. I'm not vaccinated. I take the
Okay.
test every week. My job requires me to test every week. It used to be we had to test every 3 to 4 days. So that's twice a week for us to get the results back timely. But they recently changed it to where we only need to test once a week. So I go through it every week.
You know what, Nicole? You are a real champion in this because you're proof for someone who says, okay, I'm not sold or I'm not going to get the vaccine, but I am going to do what it takes to keep everyone safe. And it's clearly you're dealing with that and you're accepting that. And then you are aware that this is real. So you probably fall in a pretty unique category because you got these people that are like, oh, it's not real, or I'm not taking it, and I'm not taking the precautions to do it. And you're totally the opposite. You're not taking it, but you are taking steps and you're taking preventive measures to make sure
Mhm.
that the spread doesn't continue. So I appreciate that. What do you say to people who are afraid of the testing process and don't want to do it?
Well, it is not harmful anymore. It used to be, oh, you take the Q-tip all the way up to your nose, all the way up to
Mhm.
your brain, to your nose, and it hurts. It's uncomfortable. But it's not even like that anymore. You can do a self-test through CVS or Walgreens, which I do every week, and I
Mhm.
just 15 seconds of swabbing with the Q-tip on each nose, and each nostril, and then that's it.
Well, good, good, good. I appreciate you for that. So now your vow renewal is coming up in December.
Yes,
How many
ma'am.
years?
10.
Oh, well, congratulations to you. And who is the special somebody?
His name is Josiah Campbell.
Deshaya Campbell. Well, I appreciate you sharing and dropping in, and I appreciate what you're doing because one of the things that we are trying to do here, and you're actually helping us do that, is educate the community, make them aware of what we are facing or dealing with, and it's real. And this is real talk. Someone who is taking these measures, these precautions, and I know it hasn't been easy. Like you just said, some people, rescinded their RSVP because they didn't want to do it, and obviously you have to look and say, okay, but the bigger picture here is for our community, you are taking appropriate steps. Now, one of the things that is really happening now is a whole lot of people are doing these rapid tests for holiday season, whether it's Thanksgiving. I think about we all getting together, the tradition around Christmas Eve, Christmas Day, as well as New Year's. Are you planning on, if attending any of these events, would you require rapid testing for those guests as well?
Yes, either that or the PCR test. But
Okay.
yes,
No
definitely.
doubt. Yeah, you didn't hesitate at all. So that's going to be our question for the today, folks, as well. Would you consider rapid tests for your holiday guests, which is something I really have to think about because we're going, obviously, around my mom, and I mentioned earlier she's an elder. So as we wrap things up with you, Nicole, is there anything else you would like to share?
No, that's it.
Well, I appreciate you taking the time to talk with us. Thank you so much.
Thank you. Have a good.
Absolutely. Yeah. Beautiful sister there, taking the time to share and talk with us and giving us information. Pretty bold, too. I mean, very brave. And you have to give her credit for that. Brave enough to step up and say, look, if you're coming to my event, this is what you're going to have to do. And I just appreciate her for doing that. That's what we're trying to do. We're trying to work our way out of this pandemic that has been so relentless, that continues to attack our community, continues to attack everything about this society where there is finances, education. Nothing has been gone unscathed as far as this pandemic. And it's not over yet. We've been doing this since January. I say that all the time. And I know things eventually will have to shift in another direction. But what we're asking you now, good afternoon, Erica Simonton Beatty. Thank you for hopping on. The holiday season's coming up, Erica, and anybody else hopping on. Jarrell, hey, how are you? I love to hear your comments, Jarrell. You got family here in town as well. Would you require someone to take us for holiday guests? We'd love to share those as well. Now, as we continue, as we always do, it's Wednesday, and I got excited because I got to talk to someone else who is out there working in the trenches, always working hard and always providing great information and a supporter of the show. I'm talking about Groundwater Solutions, and we got Dr. Tracia Black, who is joining us as always on Wednesdays, and I want to bring her on. Hey there, how you doing, beautiful?
Hi, I'm doing great, gorgeous.
Good, good, good. It's always good to talk to you. It's something about keeping empowering and inspiring women around you, just people in general. And I saw right away you chimed in when Nicole said, it's going to be too expensive. You're like, hold up, we do it for free.
$1,000. I was like, oh my goodness.
And who can afford that anyway? You're trying to renew your wedding vows. And
You're
what I
already
like about what she's doing is, she is taking the precautions that are needed. And I really love that. And I don't know if you can hear me. You may be breaking
I
up just
love it
a little.
because
Go ahead.
I don't know. I hear you, but I hear breakage, like it'll spot for a minute. But I love what Nicole is doing, and that's really how we have to live now. I mean, we went through we were shut down and we were not able to interact with each other. And
Uh,
we learned how important that is. And so now we just have to add some added layers for safety. And she's doing exactly what needs to happen. And that service can be provided free for folks who are having events. We do that, and I know other organizations out there do that as well. Will show up for that event and provide that service at no cost to her and everyone who attends.
Well, hopefully you guys, hopefully she'll stick around or you will connect and she can reach out because I know you've got the community ambassadors and that's the whole idea. And to be truly honest, that's really what it's going to take to make sure that, to have the
Mhm,
resources and people available to make sure that we continue to just do what we need to do to get together. Now, one of the things is you've always pushed testing anyway. You've always been a big
mhm,
supporter of that. And talking with some of
mhm,
the other I guess agencies or providers around the city, their focus has shifted to vaccines and booster shots.
mhm.
Why are you to focus on testing?
Because again, like she said, even though her grandmother is vaccinated or the guests are asking her, well, I'm vaccinated, do I still have to get tested? It absolutely, because we all know it, there is no doubt anyone who does not believe this, go read about it, but you can still catch COVID-19 and pass COVID-19 even if you're vaccinated. So we can't just stop talking about the need for testing, or those numbers are still going to be skyrocketing.
Yeah, well,
That is key to stop the spread.
so as we head into the holiday season, Dr. Black, and I think it's either my internet or yours freezing just a little bit. As we head into the holiday season, do you think somewhere inside of a boardroom, as we try to continue to take hold of this, possibly said, let's create a whole model around testing for the holiday season so that people, even if they're out shopping or whatever, they have a chance to get tested? Have you heard anything along those lines at all?
I have not heard anything. As you said, the entire focus now is from the state level and perspective is on vaccination. But we need to be doing that. Maybe that's something you and I can start a holiday protocol for testing. I'm trying to move to a better internet
Oh,
spot to
I
see if
know that's what you're doing, and
it
I
is me.
appreciate that.
I'm sorry.
That's all right. And while you're making that move, because we had talked about that before, sometimes you stay in your office space, sometimes it's a little challenging. So I appreciate that. And that's an idea. That's one of the things I really appreciate about you as well. And so that's something that should be offered. I just seems like sometimes the stuff is like obvious and it just doesn't seem, maybe it's too obvious. You know what I'm saying? Because
Well,
provide.
my grandmother and my mother have a saying. They say that's just too much like right.
Okay.
Sometimes that's how we operate from a public and a governmental perspective.
Yeah. Well, earlier we mentioned the approval of the Pfizer vaccine for children 5 and up, and I know you and other providers were in standby mode last week. Can you talk about the pediatric shots now and the rollout?
We can. So again, we have been waiting, but maybe about an hour ago, I got a call from another colleague
Uh-huh.
at another laboratory, and she said she just got a whole shipment
Oh,
of pediatric vaccines today.
yay.
So that's exciting. That means that they're here in North Carolina and that they're on the way out to providers.
So what are you hearing from parents though? What kind of feedback? We did also talked about the poll. Let me see if I still have it. I believe it was we've got about 26% that said maybe, 35% said no. They probably said like yeah, heck no. And then we had
Mhm.
another 37% that said yes. Does that sound about right?
I think that's probably about right. What I think is we're going to see the same trends that we saw with the adult vaccinations. We're going to have that percent right out as soon as they were available and they were ready to be vaccinated. They went out and got them. We had another group that was kind of hesitant that said they will wait 6 months. Or longer, and those people actually waited that time frame. I think we're going to see those same trends with parents and the choices they make regarding vaccinating their children. Children though who are asking for it, and we have sometimes we have patient parents who are not ready for their children to take it. They want to see some more research, or they want to see how, if there are any major adverse effects in the children who start. So I think it will be very comparable to the parents.
Yeah, and that's gotta be a tough decision. I mean, as adults, you're sitting here, and I'd say tough regardless because I respect everybody and whatever they decide, but
Mhm,
also a really tough decision simply because more research is one of the things that is oftentimes comes up. And I
mhm,
think as an adult, you're like, okay, I can at least be brave enough for myself, but for my child, I
Mhm,
don't want to.
mhm,
And so I struggled with that with my child. I had to, but I had to weigh everything out. And one of the issues that I had to take into consideration is that he was going to be in school out of this state, and he was going to be traveling from Virginia all the
mhm,
way to Florida, and in and
mhm.
out of basketball gyms, in front
Right.
of changing bodily fluids with who knows who. And it just was
Mhm,
just didn't
mhm.
go well with me to put him out there. I didn't think it would be good parenting to expect for him, if
Right.
something was to happen. And so people have to make their own personal.
Well, here's the thing. Yeah. This is what I tell folks. I understand vaccine hesitancy and refusal. I understand folks who say this is why I'm not going to take it. Well, for those folks, again, there are specific things you have to do to be safe if you choose not to take the vaccine.
Right,
If you cannot social distance, you don't have the ability to create that protection for yourself,
right.
you need to be vaccinated. In athletes, when you're face to face with other people all the time, you're body to body, you're gonna need to take the vaccine to be safe. I
Just
don't see other way to make sure that you're going to be COVID free
right.
without it.
Right. Because it doesn't matter what you're trying to do, eliminate the social distancing part, just the fact that you're engaging in a sport that is exposing you. And that's where I think people have gotten so sidetracked and missing the point. But let's talk about some good progress we're making. And that's with the new infection and the hospitalizations, they're dropping. Yay. That's great
Mhm.
news for everybody. What are some
Yay.
trends that you're seeing? Yeah, let's hit a hand clap for that because that's what we've been looking
Mhm.
praying for.
Well, here's what I can tell you. I believe the game changer has been
Okay.
is monoclonal antibodies. Are you familiar with that?
Well, and now if you're talking about the antibody treatment, is that the same thing
Mhm.
was out at StarMed last?
It's the same thing.
Oh,
Mhm.
yeah. So that's the game changer for everyone.
I believe that's the game changer. From the moment we're testing folks now and they're positive, we're talking about that monoclonal antibody, and we can get them right in to get it. We find that if we can get them that treatment within a day or two,
Mhm.
typically, the research says within 10 days that you're going to see a very quick recovery. You're going to see a vast reduced risk of hospitalizations. I mean, and it's amazing. I've had patients that were probably on the way to the hospital and monoclonal antibody treatment to them. It's an IV treatment. A day or two, they are almost back to normal, symptom free. Seeing a total reversal of symptoms.
That's so good to hear. I didn't realize you were providing that as well. So I was out with StarMed on Friday and I was with Dr. Parizima or something, Dr.
Mhm.
P. And he was explaining to me that they have the option of getting the vaccine or, using the needle or doing the infusion with the IV. And they come up and the
Mhm.
success rate is like more than 90% of this procedure.
It's very high.
Wow.
Yes.
That's really good.
Yeah.
So,
And people, I have folks who they don't want to take it. They say, well, I think I'm going to be fine. And I understand that. There are lots of folks who are anti-medication. But what I tell them, and so if you're listening and folks who may or you hear someone in the future, if you're are positive for COVID, you should not get sicker.
right.
Than getting better. And what and I understand wanting to kind of fight it out and let your body do what it's going to do. But now we have this medication that we are seeing amazing results. I know if I had to do it again, I would absolutely have that IV treatment. I wouldn't sit at home for 2 weeks sick when I could be home for a day and be back, feeling myself in 2
Right.
days.
Yeah. And
That's a no-brainer for me.
well, that's good to hear. I guess the challenge now or what we should be asking or looking for are more of these type of treatment centers or locations around the city. Do you think that will ever
Mhm.
the point where we'll have them more frequently?
I hope so. Like we have in our network, we do provide this service. I think they should be offering this at the hospital, which they can. But from what I understand, they're not going to offer it, ask for it. It's a potential that you can get it if you show up for the hospital. But I just think we know that this treatment is working so effectively that all of us, every medical provider should be offering this.
Well, that's great news to hear. And that's one of the things that I love for those of you that have hopped on. Again, I'm not able to acknowledge you. I'm not sure what's happening on my side, but I do see when you're putting comments, please share and let people know about this because that's been one of the other challenges is getting information out. Information that has been validated that is correct. So here's a comment from Erica Simonton Beatty. She says she wouldn't require a rapid test, which was our question of the day, as long as each person has been vaccinated and they aren't sick. I would hope they would stay home just as a precaution and for the safety of others. And Dr. Black, that was because we're asking as we're heading into the holiday
Mhm.
season. Thank you, Erica. If you would require someone attending your home, especially, you know how we all gather for Thanksgiving, to have a
Mhm.
rapid test to show that they are negative. And I think for me, the confusing part is, how long this virus is incubated before you start seeing signs and trying to count the days and, so on
Mhm.
and so forth. And if I understood the antibody therapy or the treatment correctly, once you're diagnosed with positive and you have the symptoms, is that correct? Then you can go and get the antibody treatment.
Mhm.
Is that how it works?
There's no out-of-pocket cost just for, again, like with the vaccination, there is no charge for monoclonal antibody treatment. Go somewhere, they're trying to charge you, you need to find another provider.
Wow. So let's talk about Word Groundwater Solutions. Where are you guys out today?
Okay, so we are always at 5104 Reagan Drive. That is off of Sugar Creek. That is our main office. We are at our standing site in Union County in the Indian Trail Shopping Center, directly across from Harris Teeter Distribution. And we are at the adult care today.
Wow. So Groundwater Solutions, Dr. Tracia Black, still out and about in the community. You see the website on the screen, the phone number 704-596-0505, 704-596-0505. Dr. Tracia Black, anything else that you would like to share? Any final thoughts?
Yeah, I just want to comment on the question of the day, and I think I said it earlier, but if you are having a gathering, I'm just going to encourage you to do some type of testing, the rapid or the PCR test. I deliver positive results every day to individuals, and you know how they say, and the God says He's not a respecter of persons.
Uh-huh.
I give results to the vaccinated, just like I give the results to the unvaccinated. They're positives. So I would encourage you, even if that person is asymptomatic, you don't see anything, to be safe for yourself, your family, and everybody else, do testing. Just make it a part of what you do. Find companies like ours where there is no charge, where we will make sure that your party is safe and COVID free.
Wow. Dr. Black, hopefully we can connect you with Nicole Campbell and you guys can be a part of them as well. But I appreciate you. I tell you that every week and I sincerely enjoy talking with you. So thank you again. And thank you for the valuable information that you always share with us here on Canceling COVID. So enjoy the rest of your day.
You too. Bye bye, everybody.
All right, Dr. Tracia Black, everyone. As I see, I'm going to. I saw here like it's not showing up your public comments, and when I click on here, I saw Miss Tammy Cherry who said hello. Hello to you. I do apologize. I'm not sure. Every time we work our way through these shows, sometimes a wrench will just drop in. We just have to deal with it. But certainly, I appreciate you hopping on, and I also appreciate you guys sharing, letting people know. You heard Dr. Tracia Black sharing some great information. And of course, salute again to Nicole Campbell as she's having the event and requiring everyone to be tested and they have to have a negative response in order to attend her vow renewal. Hey, it's her party. And she's calling the shots, and I really appreciate how she's handling that. It's a thought for us for Thanksgiving as you gather with family. Require people to be tested, or at least one of the things that I see a lot of ministries doing now is they are at least taking your temperature, giving you hand sanitizer, and creating a contact list so that if someone that you are that's in attendance, if they end up testing positive, then you're made aware of that. And I see more employers getting really clamping down, getting serious about this whole situation of whether you test negative or positive. If someone exposes the team, then they're taking the precautions to shut down, sanitize the area before they bring everybody back. And that's what it's going to take for us to work through everything. Again, I've got some gift cards. I still have another gas card to give away. I've got a gift card to Skyland Restaurant. If you go to my website, TonyaRivens.com, click on Canceling COVID. Right now, Instead of talking about the booster, which is one of no, let's talk about that. Someone who has recently gotten the booster vaccine. I'd love to know why you decided to go ahead and get it. And if you want to comment on whether you're planning on getting your child vaccinated, that's another one. Go to TonyaRivens.com, click on canceling COVID. There's a spot there for you to submit your information, and I've got a gift card for you. It's time for us to wrap things up. Certainly great conversation as always. Thank you to our producer, Amelia, for getting everything lined up. Nicole Campbell. Also, thank you to Dr. Tracia Black. It's always a treat to talk and to be with you every Wednesday. I'll be back on Friday for another conversation. We may be out on location. We're just continuing. We'll continue to try to work this out and figure out how to keep you engaged as we continue to provide information about COVID, of course, as we continue with this pandemic. As always, life's challenges make you better, not bitter. I want to say thank you again to Mecklenburg County Public Health, mecnc.gov, mecnc.gov. They're available to answer any of your questions. Their number is usually scrolls across the screen. It's mecnc.gov, mecnc.gov. They want to talk to you if you have questions. You don't have to go to the internet or go to your friend or ask someone. Go to the experts. And Groundwater Solutions, also a sponsor of this show, and you can see Dr. Tracia Black more than happy to answer your questions. Have a great day, everyone. I so appreciate your support. Thank you for hopping on. Please share so that others know that we're still here, because together we will cancel COVID. Take care.